Hi, my name is Riley Long. I'm a 31-year-old trans man, and I want to thank you for taking a few minutes to listen to my personal narrative about my journey in the medical field being a transgender person. So, I've been on hormones for about 2 years now. To start out, when we're talking about transgender people, something you hear a lot about is pronouns. So I would say going into a new doctor's office or meeting a doctor for the first time, something that makes me feel automatically comfortable is when a doctor asks what pronouns I use, or even when I'm scheduling an appointment. The office is already aware of that, whether it's on the paperwork, it'll list pronouns, or whatever it may be. The more aware you are, the more you ask about that, I think the more comfortable the patient will feel. Also, pronouns are not just for transgender people, so having your pronouns displayed, whether it's on like your badge or a pin, can be really good, just so everybody's on the same page with that. When I first started hormones, I had not legally changed my name or my gender marker. So, not only having preferred pronouns, but having a preferred name is really important. So, again, maybe being on paperwork and also making sure that not only you, but everyone in that office is using that preferred name and not using the legal name. Of course, when it comes to certain documents, we understand you have to have the legal name. But just when someone's calling me out, you know, calling me the wrong name when I'm there for services for being transgender, accessing hormones, that is a really huge mistake. I would say most of my problems or concerns have come less from doctors and more from the front desk, the receptionists, maybe the nurses that didn't understand how to address me. They might ask inappropriate questions, and I don't know how much doctors are in charge of organizing and like training their staff, but there really needs to be training about transgender people and what we need, how we should be talked to, especially when we're talking about our bodies, because most of us experience gender dysphoria, which, if you don't know what that means, it's feeling uncomfortable with parts of our body that would align to the gender that we were born as. So, me being a trans man, I am gender dysphoric about having a female chest. Okay, you might also be gender dysphoric about what you have down below, or it could be lots of different things. So, bodies are uncomfortable for us. Bodies are uncomfortable for us to talk about. A lot of transgender people I know avoid the doctor because they just don't want to have routine exams. They don't want to have to take their clothes off, whatever it may be. You want to treat a trans person no matter how they look, how their gender expression may be. Because for me, I'm a trans man. My gender expression is pretty masculine, but you may have a trans man who comes in wearing a dress. And that doesn't mean all of a sudden they're, a girl. You want to make sure you're a safe environment, but treat them how they want to be addressed. A lot of trans men feel really uncomfortable talking about their menstrual period. Of course, a lot of this stops when you start testosterone, but even phrasing like questions you may ask in a different way can be helpful. I don't know an example of what you could say instead of menstrual period, but there's ways that you can say things that make someone feel more safe and more comfortable. A lot of the time that I have received hormones, I've gone in and asked doctors questions and felt like I knew a lot more about the hormone replacement therapy I was going through than they did. So, this is the first step, but like, please be knowledgeable about the patients that you're caring for. This is a huge journey for people, something that people may have waited their entire life for. Do you realize that trans people may have a lot of uncomfortable feelings when it comes to taking off their clothes or getting exams for parts of their body that they do feel gender dysphoria about? The clinic that I was going to for hormones to get like some moles checked out, and they asked me to remove my shirt because that's of course where some of them were, and they had me put on a gown, and that was all fine. Because it was like a nonprofit, they had a lot of like students coming in, like all checking them. They kept asking me if I would take the gown completely off, and just like, I could not tell you how terrible I felt. I felt like I was some kind of sideshow attraction. And I understand that like students need to learn, but maybe like in this example, trans people might not be the best example for all these people to be there and for them to have their shirt off. Like, this part of my body makes me more uncomfortable than anything else. So asking me to remove that, like, you should know that that's just not okay. I mean, there needs to be a way around doing certain things. One of my most memorable times in a doctor's office was when I was trying to schedule an appointment, and they were asking me what the appointment was for. And I wanted to get birth control. So I said that I needed birth control, and the receptionist was like really, really confused because, like, yeah, I'm a trans guy, but like I can still get pregnant if I have sex with a cisgender guy. So just training, having some kind of computer system where you can put in preferred names, put in that this patient is trans. Like, it doesn't seem like that difficult of a thing, but all these places I've gone to have like really struggled with these simple things. Those are my experiences being a trans patient. I am really thrilled that you all took the time to learn today, and I hope I helped you understand a bit more. I cannot speak for all trans men or for the whole transgender population. Some trans people will come into your clinic and not even be seeking hormones, but they will still have a preferred name and preferred pronouns, and they may still feel uncomfortable about their body. Like, there's so much I can go into about what it means to be trans. I can't cover it in this short amount of time, but please educate yourself, train your staff, and treat us like anybody else. Treat us with extra care, but also don't treat us like we're some kind of strange oddity. We just want to be like everybody else. So again, thank you, and goodbye.